Hello everyone. Today we'll talk about disaster response team in hospital. Yes, so what exactly has been done during disasters or after the disasters has happened. So basically, what is the scenario like? If you look at the pic that I've just shown you in your screen, it seems that it is a disturbing reality of today's world, today's happening. Disasters are bound to happen and it's happening more frequently than ever. Earlier times, a disaster used to happen, but there was a gap, a time interval, a few years in between would have passed around it. But look what is happening in and around us. Disasters are waiting to happen and probably happening are much more frequently. Why? Because of the climate change. So for these kind of disaster, we need to understand how do we react and how do we mitigate in the eventualities of the fact that natural calamities cannot be avoided. So first hand response as a humanitarian persons, it's the hospital that comes around it, the victims that needs to be taken care of. So hospitals are the first institutions are the one who are been affected by the disaster who can be the first line or initial line of defenses. So they need to take much more preparation in handling such issues. Remember, in cases of earthquake, if even the hospitals are not being left, even they are being wrecked altogether. And in such scenario, how do we go ahead with it? Allow me to give me an acronym for disasters as such, wherein D for disasters, I, which is induced, S for situation. Remember, disaster induced situation. A is after, S for standing for severe, T for transformations of, E ecological, environmental, or probably even economical. R is your responses. So what you'll be looking into the acronym full form would be disaster induced situation after severe transformation of ecological responses. And that is a fact that we need to understand as far as disasters is concerned. So, what are our main aims? First and foremost, within the limited utilizations of resources that is available to us, how can we have an optimum results? Probably save as much life as possible. Delivering care at the level of a useful hospital standards or benchmark may not be possible as an altered standard would have set in, and we need to accept the fact. Remember, at the time of disaster, resources are stressed, things are at limited supplies, and probably whatever is in supplies are, may not be in a proper order. So we need to understand the effect and take into consideration the special events or the special situation that we are in. So, what are our altered standard or the deferred standards or not so normal standard, if I may say so, is mean changing infection control standards? Probably yes, to permit a group of isolation rather than a single person isolation units, limit the use of ventilation or surgical units, create alternative care, as in what we are looking into it in the waiting room, in the waiting area, in the lobby, in the area which are not designed to provide the medical care. It could also mean the changing who provides what kind of care, like enhancing the scope of the physician factor as per the case might be. This needs to be understood time and again. So yes, if we want to do it on a three predicament of disaster management, first, if we can predict disaster is going to happen or not, then probably prevent disaster from happening. And in case if we cannot predict, in case we cannot prevent, probably can we prepare ourselves, which is the only alternative that has been left in front of us. So hospital disaster plan. Hospital disaster plan is to reduce the pressure on the hospital management when a large number of casualty happen, when the natural disaster is of magnanimous scale. What do we do when there is an influx of a number of patients beyond your capacity that goes around it? The plan activates to immediately provide an efficient care to the patient within the shortest span of time, and that is what we need to look into it. The mock drill has to be conducted periodically so that every doctors are aware, every paramedical staffs are aware of what exactly is going to happen. Adequate storage of spaces in emergency department. Hospital disaster action plan is hospital disaster committee probably what we are looking into it, if we have a top committee who's going to look into the functioning of the hospital during the time of dire consequences. So what are we looking into it? Can we provide a care the site at the site where the event has occurred, where the number of patients are maximum, or alternatively, we have to look into provide care at the hospital in the premises itself. So we have off premises and in premises as far as disaster management committees are concerned. Based on this, if we can build the external disaster care plan and the internal disaster care plan as to what can be done, what kind of patients would be looked, what kind of victims will be looked in the site, and what will be who all will be brought into the hospitals. So, internal disaster plan, the multidisciplinary approach is first and foremost safe working physical status of hospital in terms of hospital or the alternative sites that we are looking into it. Then that is what is mandated. Then do we have the requisite amount of equipment, medicine, infrastructure, personnel needs to be understood. Sufficient trained human resources, logistic power supply with alternative backup, all adequate reservations of water supply, proper transportation facilities, pharmacy supplies. I have already stated it. It is your resources that we are looking into. Resources in terms of medicine, resources in terms of equipment, resources in terms of human resources, paramedical forces. What can be, what is available, and how can we ask everyone to join in whatever way that they can help in mitigating the disaster. That is what we're looking into it. The other way around, in terms of equipment, would be your generator. Vanishing of the electricity is the most common scenario in disaster. Now we need to have a local power backup that is in the form of generator. We need to understand of potable water, is it available or not. These are things that needs to be identified. External disaster plan is where we coordinate or communicate with different institutions, different networks, and believe me or not, this is one of the best method to mitigate. If we have some water committees or water bodies or preservation things, they can be looked into it. The fire department can look into other kind of generation facilities, generators in terms of electricity are concerned. The medical team can only look after the hospital. But if we can allocate certain resources, certain responsibilities to different institutions, it helps us to have a multi-pronged approach to avert the disaster or probably to take care of the disaster victims. This is what we can do in terms of documentation and record keeping, hospital traffic control, periodic public notification, resource mobilization, and collaboration with other teams. This is how we need to understand what can be done. So, yes, external disaster plan is coordination and communication with other institutions, documentation and record keeping, hospitals and traffic control, periodic public notification, public drill, identifying what exactly is to be done, resource mobilizations, and collaboration with other departments. So, yes, there are three levels of preparedness. One is awareness, mid level, and advanced level. Now, what is the initial levels? The elementary level is awareness, wherein every people, the community has to be prepared for any sort of eventuality. In case a disaster strikes, what is expected? Probably that needs to be understood. Then, as far as the hospitals are concerned, the staff need to be uh, put into mock drills, and this will help them to ascertain during disaster what is expected of them. Mid level is the leadership level within the department, departmental role within the hospital. Advanced level is the advanced leadership level within the hospitals. The top echelon of the hospital, what do they do? They will allocate the resources where it is required, at the most important perspective points. Hospital roles within the community as on when on basis. So yes, there are three levels: awareness, mid levels, and the advanced levels. So I'll just give you few pics of what actually happens after earthquake. Now, this is how we look into it. Look what we are. I'm showing, trying to show it to you. Earthquake does not only affect the community or other infrastructure. Infrastructures may include the hospital itself, and this is how the pic will be showing it to you. That is seen in your screen. And how do we do it? It look where the hospitals are. The hospitals are out here and probably with a makeshift camp. Now, these are my hospital beds. These are my temporary chairs, which is plastic or molded chairs, if we want to go call it. Now, these are available and these have been situated, probably erected somewhere outside the premises. And this is near the hospital. This is inside, if you look into it, at the site of the disaster, completely a temporary artifact that have been enacted or erected just for the fact of giving supplies to the patients, giving medical care to the victims, and that is what we look into it. So healthcare services intense. Look, this is a hospital, and this is a temporary tent that we have come up with. This is a prepared status, but what happens if it is an unprepared status? Some sort of a temporary structures are again being enacted. Probably, and that is what we are looking into it. Remember, whenever the earthquake happens, it is combined. It is a major time, maximum number of time, approximately 80 to 90% of the time, it follows with a rain. Now, this is what needs to be done. So it's a double whammy. You have rains, you have earthquake, and in all probabilities, most likelihood, there would be load shedding and there would be no electricity, and that needs to be identified. That needs to be understood time and again. So I'm giving you the pick where we need to go about the yellow area, the green area, the type of patients that has been allocated. Is it severe? Is it adequate? Is it just deferred treatment that can be done? Based upon it, the documentation that goes around, we need to identify. Remember, in an earthquake, if you look into it, the standard treatments in hospitals are only about 5%, where are 95% of the patients are done in not in the standard areas, probably in the lobby, probably in the corridor, probably in the site, probably in the parking, you name it and you have it. And it is the numbers of victims, the number of patients are much more higher, and you need to understand this thing. So it is not the ideal situation. Ideal situation, only 5% of the victim would be taken care of. But in the 95% of the situation will the patient would be looked after in areas which were not designated for medical use in the first place. So, will this type of socio-cultural practice be enough? No. If I may say, the benevolent social cultural impact or practices, if there is a disaster, there are victims. I am sure people from other communities will come up, help in. Definitely, yes. Um, I am also sure that in cases the infrastructure of the hospital is not sufficient enough, you may build up a temporary structures to treat your patient. But honestly speaking, will this type of social cultural practice, no matter how good it is, be enough to face future disaster? The simple answer is no. It is not possible. This is what we need to keep it in mind. So, what do we need to have? We need to have a definite national disaster preparedness plan. We need to have the world community coming together in cases if the catastrophe is big enough. Now, these are things that needs to be understood time and again. What we should have and how do we proceed along with it. So. Before winding up this particular videos, let me give you the key takeaways. First and foremost thing is federal government preparedness. There should be a policy with the provincial government, policy for the federal government. The government has the biggest impact in such kind of interventions. Disaster preparedness plans forms from every responsible institutions, and when I say every responsible institution, I am not talking only about the fire department. I am not talking only about the water resources department or the electricity department. I'm also talking about an education institutions, the university, wherever there's a mass, wherever the people are there who can lend a hand, it helps us to mitigate such disaster. Proper coordination and communication within the stakeholder is a must for averting or attending such disaster victims. With this, allow me to come to the end to this presentation. Thank you for watching this video till the very end.